model that we really have here is bridging the gap between rehab and performance training, because there is obviously so much carryover. You talk about neurological deficits. There's a lot of neurology that is applicable to performance training that I think is very under the radar for most athletes. They don't really look into it. There's some coaches that are starting to look into the power that can be had from tapping into that, but it's kind of gone under the radar for a long time.
I'm Garrett Salpeter, and I believe that the most powerful and transformative way to help people recover from pain and injury, heal from trauma, and reach their highest levels of fitness and performance is to focus on the nervous system. In this podcast, we'll share knowledge from the frontiers of neuroscience and inspirational stories of how applying that knowledge has empowered people from all walks of life to heal, adapt, and grow. Hello, NeuFit Nation. Welcome back to the Undercurrent podcast. My guest today is Phillip Parker, founder and owner of Omni Rehab in Harlingen, Texas. So it's down in South Texas in the Rio Grande Valley, not far from the border of Texas and Mexico. And he is a recent winner of our Neubie Grant Program because we are big believers in his mission to bring the highest quality technology and care to the people of the Rio Grande Valley, where it's a little bit of a therapy desert. There's not as much of the technology and as many skilled therapists as are available here in Austin or many of the cities that you listeners are all living in. So it's really cool to get to see Phillip and the work that he's doing, and I'm excited to have him on to share his story and talk about his practice here today. So Phillip, thanks for joining us.
Thanks, Garrett. I really appreciate that, and you hit it spot on. We're really excited to be working with Neubie and also get this opportunity to join you.
Awesome. Yes. It's been really cool to see the work you guys have done in the first several months with your Neubie. Can you tell us a little bit about your practice, also in the context of, how different it is from what's available there in the community?
Absolutely. So our practice is really focused on providing more individualized care. That's the biggest thing that I think we bring to the table, and also emerging technology. And highest quality of care. So whenever I came down here, I tried to emphasize bringing things down that it might be a modality, it might be a certain treatment method or certification, things like that will enhance outcomes. Because when you're this far away from metropolitan areas as we are down here, I don't know if people are familiar, but we're probably about, I'd say, 2 hours away from Corpus. That's probably the closest metropolitan area, and then San Antonio is 4 hours away. So we're not near those places. And the biggest thing that you lose from that is that you don't have as much competition forcing you to adapt and to come up with new methods, better methods. And down here, since we're a little bit further away, sometimes that goes, that kind of gets lost, the competition side of things. And with that comes complacency. And with complacency in rehab comes diminished outcomes. And so that's what we're really after with Omni Rehab.
I love that. I love your perspective on competition too, because I totally agree with you. And I think it's also a lot of times the opposite from what people think, or sort of that knee-jerk reaction. If they think of someone else, coming and opening a practice nearby or something like this, there can be for many people this sort of reflexive notion of, how dare they encroach upon my territory, or they're going to take all my patients and clients, or, this sort of thing, where there is another, equally, or I would say certainly more productive perspective, which is what you just shared, which is, competition. You listen to the best athletes. It's not about beating the other person. It's about using the fuel of competition to get better. And really the competition is themselves being better today than they were yesterday, right? It's really competition with ourselves. And the fuel of having other people there forces us to continuously improve and not become complacent. So I really, really appreciate that you shared that. I think that's a great note on which to kick off the discussion. And then, can you talk about a little bit more about the market there in the Harlingen area? Because you actually grew up there, right? And then, so, when you were growing up, what was it like if you wanted to get physical therapy, or I know, so you're an occupational therapist too. I don't think we mentioned that yet on the air, but what was it like for you growing up there? If you wanted to get care or your family wanted to, and then, obviously, how is Omni Rehab different?
Yes, so basically, I grew up here in Harlingen until I was about 12, but my family has always been from this area. So I ended up going to my parents split when I was I think in sixth grade, and I ended up going to high school south of Dallas, in Glen Rose, Texas, actually. So I would always come back down here though, so I'm very familiar with the valley. And honestly, the biggest indicator I can give you is that I had never heard of anybody in my family getting rehab and they've had, people in my family have had a lot of medical issues. So I think the only time was my grandfather before he passed away had some physical therapy at home health. Um, but really, it's not something it wasn't something that's prioritized. And obviously, rehab's become more prioritized in general over the past decade. But still, at that time, I really had no idea what it is. I had no idea that physical therapy existed or anything like that. So, I mean, that kind of tells you right there. These days, come back, fast forward all this time. Now Harlingen has a school of health professions, a local high school, and they have a lot. Obviously, there's a local University of Texas branch here that has an OT program, fixing to get a PT program. And so the landscape has changed, and I think that's going to end up changing the market even more because more therapists are going to want to stay in this area. So I think that's the biggest thing, is that we're able to expose the younger generation earlier, get them familiar with everything, and then hopefully keep that so-called talent, keep those people around here to work with the community that they grew up in. I think that's going to be the biggest change over the next decade, and we do a big part in trying to cultivate that, because anytime anybody calls me for observation hours from any of these colleges, or even the high schools, I'm always willing to have them come in. Whenever we have time, we'll schedule them to come in and observe, because I remember being at that point, and you have those places where you go and you can tell kind of the people that don't necessarily, not that they don't want you there, but they're kind of like, oh, okay, it's another kid getting observation hours. And then those places that really change your perspective on rehab, and kind of get you more interested in what you already are planning on going towards. So that's what we try to do here, is I kind of try to take myself back to my first observation experience when I was still a firefighter, and kind of think about what made me flip that switch and say, okay, this is what I want to do 100%, and I'm going to learn as much as I can, because I really don't. I'm a big believer in being interested in things that you're learning, because I don't think you learn in the same capacity if you're not interested.
Yeah, 100% there. And I think that's, one of the issues that I certainly had, that probably everyone listening to this can relate in one form or fashion to in school growing up. You're forced to learn some of these things. And when you're not interested in it, you may be motivated to learn it for a test, or you
Mm-hmm.
may not care enough about grades to not really learn it if you're not interested in it. But then now I look back and I'm like, dang, if I could go back and learn, neuroscience or stuff that I'm passionate about, like now I'd love to go to school, now that I know what I'm interested in, if I could study in that, focus on that stuff. Right. But I think that's
Absolutely.
such a good insight there, and probably a good pearl of wisdom we can pull out too about that is really a good way to live life. I think sometimes we feel pressure to have this big purpose, but following the threads of interest, day after day after day, is often can lead to a great life as well. So I love that you said that. And then you mentioned your history. So you were a firefighter paramedic in Harlingen for a few years before deciding to become an OT, and then obviously opening the practice. What can you tell us, what sort of, just peeling back the layers in your personal experience, what sort of led you into that first career as a paramedic firefighter, and then what was it that did cause you to make that switch and become a clinician and open the practice?
So I kind of fell into the firefighter role because I was I was kind of I wasn't a great student in high school. I mean, I got by, but it wasn't, just like you were mentioning right now. If you're not interested, you're not going to apply yourself in the same way. So I kind of got out of high school and I did some of my basics and had a part-time job and was kind of wondering, what am I going to do? I had an uncle that worked in the fire department, and I kind of grew up, I'd go visit him in the fire department. I always thought it was cool. So I was like, yeah, you know what? Let me try this. Ended up doing that. Loved it. I went through a 6 month academy for the fire department, then went on to get my training in emergency medicine, and I loved it. But I also had that stress that there's a certain stress that you have when you work, 24 hours a day. Uh, it's hard to explain, but I'm sure everybody knows, and it's well documented. First responders, there's a lot of stress. Even just waking up in the middle of the night, out of nowhere, that's a lot of stress on your body, on your nervous system. And so this kind of goes into stuff you talk about all the time, and that sympathetic drive. You're always having that teeter towards the sympathetic drive position if you're not getting the rest you need, if you're not having these things that you need to bring to your body, then it's going to accumulate over time. And so I kind of saw that, and I was still young. I got in when I was 21. So by the time I was 23, I decided, I want to keep continuing my education. And thankfully, with the time off from the fire department, 24 on, 48 off, I used those 48 hours to finish my bachelor's degree. And thankfully, I had a lot of awesome professors that accommodated to my schedule, because every once in a while I'd have to miss class. So that was when I started to look into OT, was right after I graduated with my bachelor's. And it was something I was always interested in because of stroke. We have down here in the valley, it's the highest stroke rate in the United States, this area, because of the diabetes prevalence. So I mean, I'd estimate that in a month I'd probably respond to at least 10 active strokes. So I got real familiar with it, and I saw the initial symptoms and everything, very familiar with it, very familiar how to treat it on the spot and get them to the hospital. But then I started to wonder, okay, what does this look like later on? What does this look like residually? What does this look like recovery wise? And are they able to recover? And that's what led me into reading more into it. And eventually, a good friend of mine is a nurse practitioner here, and he got me into contact with the therapy department at the hospital here, the same hospital that we were transporting patients to. And then I ended up doing observation hours there, and it was history after that. I loved every minute of it.
That's awesome. I love the sort of actually just what we were talking about a few minutes ago, sort of like following your interests, seeing, being a paramedic and doing EMS, and then seeing stroke patients, and then sort of following that thread of interest and that pull of curiosity and seeing where that leads. That's awesome. That's a really cool story. I love that.
Thank you. I appreciate it.
Yeah. So now we'll fast forward a few years. You've become an OT, opened up this practice. So Omni Rehab. Tell us what you're doing, because one thing that stands out to me is how interesting your mix is between the stroke patients and other neurological injuries or neurodegenerative conditions, whether stroke, Parkinson's, other neurodegenerative conditions, and then the athletes, and with technology like the Neubie and others, how you're sort of also a go-to for athletes in the area. Can you just talk about your practice and give people a sense of what it's like there in the facility?
Absolutely. So the concept of, well, the model that we really have here is bridging the gap between rehab and performance training, because there is obviously so much carryover. Even you talk about neurological deficits, there's a lot of neurology that is applicable to performance training that I think is very under the radar for most athletes. They don't really look into it. There's some coaches that are starting to look into the power that can be had from tapping into that, but it's kind of gone under the radar for a long time. But so here on the clinic side, we have about 50-50 split between neuro and typical ortho cases. I'd say our neuro cases are a mix between stroke. We have MS occasionally, a little bit of, we'll have Guillain-Barré and stuff like that every now and again, peripheral neuropathy, and um, a lot of Parkinson's. We do the LSVT program here too. I don't know if you're familiar with that.
Is that
Uh,
the big and loud
yes,
that
sir.
one?
Yes. So we do that, which I've seen. It's very powerful for some of the patients. So on this side, we have, I say on this side because I'm actually on the clinic side right now. So on this side, we do traditional therapy, as they say, but we like to really individualize our care. So the best way I can kind of put that into perspective is that since I've opened the clinic 2 years, about 2.5 years now, I haven't marketed really at all. I haven't spent, I don't think I've spent any money on marketing. Um, and I think that can't happen everywhere. I know that if I was in DFW area or San Antonio, that's not gonna, we would have been closed by now because there's so many competitors and there's so many things that are, billboards, all that good stuff, commercials, um, social media. We do post on social media, but it doesn't cost us any money. But the reason that is because all of our referrals are either from people that I know in the medical community or they're from word of mouth. Um, Typically, that's from patients that we've had. So patients that tell their friends and their family, their any of the relatives, coworkers. That's how we get patients, and it's just continued to grow because of that. So I'm a big believer in letting the work speak for itself, and it really has. We've had great outcomes, um, and it's not anything mystical. I think that's what I don't like about some of the stuff I see on social media is a lot of these clinics are kind of making it seem like, okay, you can only come to this place because we're so different than the rest. And really, it all comes down to the clinician paying attention to the individual that they're treating and not treating a condition, because everybody's unique, everybody presents differently, even if it's the same condition, and we have to tailor our rehab process to that rather than going off of um, protocol driven stuff and just say, oh, we can do this, this, and this. And I think that's the biggest thing. I think that's why we've had the retention. I think that's why we've had the referrals and continue to grow. And that also coincides with the performance training that we do, because a lot of the times the referrals that we're getting for that, it's like we might have a mother or a grandmother come in for a hip replacement, and they're exposed to the other side. We have some turf on the other side and a bunch of more sports oriented stuff. So they see that and then they start asking, what do you guys train athletes here? They'll see athletes here and they ask them, and they say, oh, my grandson plays football. He could use some help. And so I'm a big believer, like I said, in that natural growth. And that's exactly why I wanted to come back down to the Rio Grande Valley, because it's still a little bit old school, I'll say, as far as that goes. That's how people make decisions here, is they listen to other people in the community, friends, family.
Thank you so much for listening to the Undercurrent podcast. If you're interested in learning more about how NeuFit and the Neubie can impact your life, please visit our website at www.new.fit, that's neu.fit, so you can learn more about how it might integrate into your professional practice, how you can use it as a patient, and you can also connect with our team there. Yeah, I like that. I like that perspective a lot. I love a lot of what you said there, including the notion of applying, neurology and neuroscience into performance training, because it's obvious if you're talking about stroke, like, yeah, it affects the nervous system and movement, but it's sort of less obvious for sports injuries and for athletic performance. And yet, to me, that's one of the biggest breakthroughs is being able to prioritize that neurological guarding, protection, inhibition with injury. And then those same mechanisms, weaken performance as well too. So
Yes.
I
And
love.
sorry, I didn't mean to cut you off.
Oh, please go ahead.
I was going to touch on that point you're talking about with the performance training. We've been using the Neubie just recently a lot. Like it's been running I need to make sure it's if it needs to cool off, we probably need to check on that because it's been running a lot because we've had um, in the past month for some reason a lot of ACL injuries. And I work with a couple surgeons in the area, and thankfully they're the same school of thought as I am as far as that prehab. If it's not, if the MCL is not as involved and it's just ACL, meniscus, and a little maybe some slight MCL tearing, usually we can wait for the surgery about 3 or 4 weeks, and do some prehab and strengthen up that quad. And a lot of the research says that if you can get that affected leg to be within 80% strength of the unaffected leg, then the outcomes post surgery and the rate of re-injury are diminished greatly if you're doing these 4 weeks of prehab prior to surgery. And so that's when, like I said, the past month we've had 5 ACLs here. Kids that I know, kids that I've trained, or kids that have come in for other injuries. And while it's heartbreaking to see it, it's also kind of comforting to know that they're going to get the best care here. So we've been using the Neubie, like I said, to get those quads firing a lot. And I've been running a little bit of an experiment, a case study. I need to write down more of the data, but I don't know if you're familiar with the M trigger, EMG. It's
Oh yeah.
just,
Yeah.
so I have had one of those for a long
A
time. I like,
surface electrode, right? That gives you the EMG measurements. Yeah.
yes, sir. So I've had one of those for a while, and I like to use it I'm a big believer in biofeedback. Like visual biofeedback is huge especially for doing isometrics like that. Um, so I started to do a little bit of a case study where, especially those first, like, I'd say 3 or 4 days after the ACL tear, when they're starting to be able to move a little bit and they're trying to get their quads firing, it's extremely hard for them to because of the inhibition. Their body is trying to protect it, and it feels just like they can't recruit that muscle. The muscles obviously hasn't atrophied in 3 days, so it's not anything as far as that goes. They haven't lost strength, they haven't lost mass or anything like that, but they have lost the ability to recruit that muscle um, temporarily. So what I've been doing is putting the EMG electrodes on there right when they'll come in. They begin the treatment session, and I'll measure the wattage that they're outputting during the quad set during the isometric, and then I'll run them through quad sets with the Neubie and doing the rest I do about 5 seconds on, 10 seconds off. We'll do that for 2 minutes. So we'll do a couple sets with the Neubie, and then we'll go back and do another set with the EMG, and you can see the recruitment pattern and the activation is quite a bit different from that first set, and then going through a couple sets with the Neubie and then going back to the EMG, that wattage is increasing. And so that's all, well, they call it the mind muscle connection, right? But it's not um, as mystical as it sounds. It's really just getting that pattern to position itself in a way that it has kind of been dormant because of the inhibition, because of the injury. So it's kind of just bringing that out. But it's been interesting to see, and I'm excited to kind of get all that data because, like I said, unfortunately we have 5 or 6 ACL tears right now. Coincidentally, they all had surgery within a week of each other.
Oh wow.
Yeah.
Interesting. And I love that. I'm glad you shared that using EMG. I mean, I like anything that can show before and after changes, because to me, just from looking at it from first principles, if I'm going to spend the time, energy, and money to go do a rehab session somewhere, I want to have something to show for it. I want to have some increase, some improvement, even if it's small, right? But I want to make sure I'm getting a return on that investment of time, energy, and effort. And I love, that's a really good one to be able to look at EMG amplitude and to see that. So I love that you're doing that. I love that you're seeing changes with the Neubie there. That's awesome. One thing while we're talking about your practice and the mix of rehab and performance, and then the mix within rehab of ortho versus neuro, what's your mix in terms of insurance, cash? I think there's probably some limiting beliefs that anyone would pay cash in, probably, in an area like that.
Mm-hmm.
demographics wise? Is there, but of course, people are coming in for performance training. There's some cash, but on the
Mhm.
rehab side, what's your mix?
So I'd say probably right now we probably have 65% of our patients are insurance based, and the rest is a mix between either a rehab contract. I have a contract where they can kind of pay if they're doing a 6 to 8 week treatment plan. They can pay monthly for 3 months to cover all of those visits. A little more affordable for some people. And then we have obviously the cash rate. So I'd say, yeah, somewhere either 70/30, somewhere around there. It kind of fluctuates. Sometimes we'll be 60/40. We'll have more cash payers. So usually it's because of, it's not that they don't have insurance, it's just because their deductible's so high. And it's, especially right now, it's the end of the year. So their deductible is going to start over and they have a high deductible. They don't want to, like, they have a $5,000 deductible. I tell them, okay, well, it's not worth paying $5,000. Let's just do this contract because that's going to start over again. So you're not going to, you're not going to hit that deductible anyways. So that's, sometimes it's because of that. It's not necessarily that they don't have insurance. So that's something that's the biggest. I think that's the best decision I made initially, was doing a hybrid model, because whenever I was first getting in and kind of getting recommendations and advice from other clinicians, I was told, you know, you need to pick. Are you going to be insurance based or cash based? And I didn't say it because you know how sometimes you're afraid to ask dumb questions. And I always wondered, like, why do you choose? Why choose? Like, why not offer both?
Mm.
Because it doesn't make sense, especially if you already have the insurance contracts. There's no reason not to offer the cash. So the cash based prices. So that's what I did. I was waiting at the beginning when I was beginning to open. I was thinking, okay, something's going to happen because I shouldn't be running a. Nobody said anything about a hybrid model. I didn't choose, so I was thinking there's something, a loophole or something, that was going to come out and get me. But now I had somebody ask me the other day about it. She's trying to open up a practice in Dallas area, a friend of mine that I went to school with, and that's the first thing I told her. She asked me about the insurance and cash, and I said, work on the insurance contracts, get them done before you open, and offer both. It's 100%. That's the best advice I could give.
Yeah, and that's getting to interact now with hundreds of practice owners around the country. That hybrid model does seem like the best. Being selective, some payers it makes sense to work with if you're trying to, especially if you're trying to increase your volume. I mean, there's some practices can be successful doing all cash,
Hmm.
but there's likely a ceiling on the volume that you can do. Um,
Exactly.
Perhaps some limiting beliefs mixed in there, of course, but
Yeah.
it seems like the right mix. Pick some payers, have some cash. That kind of on average overall seems like a great approach too. So I like your perspective on that. Um, as we wind down towards the end of the conversation here, you mentioned before and after changes on EMG with some of these athletes recovering from ACL tears and surgery. Are there any other success stories using the Neubie that sort of stand out top of mind for you in the first several months of having it there?
Definitely. There's several. The one feature that I'm really kind of nerded out about was the mapping mode, because it's very precise, and that's the thing is, yes, you can have that precision if you're kind of manually filling an area or palpating an area, but sometimes you can't, depending, for whatever reason. Sometimes it's an area where there's a lot of overlapping muscles, or everybody's anatomy is a little bit different. So even, obviously, all therapists know insertion, origin points, and all that, but it's not. It's different with everybody. Everybody has their own unique positioning. So I am a big fan of using that mapping feature whenever I'm kind of not, I won't say lost, but I'm wanting to be more precise in what we're going to target in treatment. And I've used it for, obviously back pain's a good one to use it on, because you can really pinpoint a certain area, and then you can kind of see what muscles are affected, especially really right along the spine too, on probably a couple inches on the outside of the spine either way. there's a lot of those lengthy muscles. There's a lot of spinal erector muscles, and um, those are hard, obviously very hard to pinpoint. So that the mapping feature does really well for that, and the pain modulation has helped a lot too. We have a lot of people that have used it over the past month, and they'll come in and ask, can are we doing the newbie, or can we do the newbie at the end? So they're very familiar with it, and it's been a hit with the patients. And I'm a big fan of using it for pairing it with rotator cuff strengthening, or with just basically muscle motor recruitment is really the biggest thing that I love using it for, because some of the people that have rotator cuff tears that I treat, they have partial thickness tears, or they have an old injury, and that's why I always tell them, I always try to get them to not get an MRI right away, because that's I tell them that they probably have a tear, but it could be an old tear that's already healed. It's still going to look as a tear on there, because that junction point that tore is not going to heal. It's the tensile strength of the remaining tissue is what's going to strengthen. So it'll still necessarily on the MRI, it'll still look like a tear, even though it's old. So a lot of them were coming in with weakness, and these are usually older patients. Adding the newbie to the bicep or the deltoid whenever they're doing shoulder flexion, that I've seen that help a lot with patients, and even psychologically as well. It helps physically, obviously, but psychologically, for them to see those muscles firing a little bit, and something that's been dormant to them that I won't even get into learn non-use, because that'll take a whole nother hour. I don't want to waste your time, but that's a huge
It is a
thing.
great topic, though. Yeah.
Yeah, it is, and so I see it a lot, and that's something that I think the newbie is very applicable to, is that learn non-use, and then getting those motor patterns to redevelop, because a lot of times people just think they'll continue down that path, and they'll think, okay, something's wrong, like I need to get an MRI, something's torn, and really it's just that they're not recruiting that muscle, because they haven't used it in so long. It's been months and months, or if not years, um, since they recruited it. So this is a powerful method for them to visually see it, obviously the sensory, and then also activating that muscle to give them that little push over the edge. And side note, I will say, the first thing I did when I got the newbie, I was here, I think it was like a Friday night or something, and I was curious. I was like, I'm gonna use it because of the direct current, AC current. I was curious, because one of the things that I would always try to use my e-stim devices for stroke rehab is um, shoulder flexion, right? And you're not going to get much shoulder flexion with the e-stim device. You'll activate some of the muscles, but really you're not going to actually move a shoulder, right? Unless you turn it up way too high. And so the first thing I did was I put it on my deltoid, and so I was wanting to see how much recruitment I got, and that was the first time I've ever used any type of e-stim device that actually I could feel my shoulder actually being pushed into flexion. And it wasn't an overwhelming. I mean, it didn't feel great, right? But it wasn't an overwhelming amount of current. But I could tell the difference from using e-stim for so long, and trying to recruit certain muscles. I could see the difference right away.
Nice. I love that. I love that. I think that's a great cherry on top, great note on which to end here. So thank you so much, Philip, for the work that you're doing, bringing this quality of care down there to the people of Harlingen and neighboring communities, and for coming on and sharing this here. I think it was great to hear. I love your perspective on so many aspects of treatment and how you're running a business, and the way you're interacting with patients. And I think really being a leader in the community. Also very cool to hear your story about how you got to be here and the path through through paramedic EMS and following those threads of interest and everything here. So some really good gems in this conversation. For people who are interested in following your practice, learning more about you, we got Omni Rehab TX, right? So tell us the website, Instagram, other channels. What are the best places to find you?
Yes, sir. We have our email is info@omnirehabtx.com. Website is OmniRehabTX.com, and same thing for the Instagram. So,
Awesome.
and Facebook as well. So,
excellent. Well, thank you again for coming on the show, and thank you everybody for tuning in to this episode of the Undercurrent podcast. Please like, subscribe, leave a review. We're on your favorite platform, and we will see you on the next episode.